Thank you, Vaishnavi. Good afternoon, everybody. It is indeed a pleasure to be talking in front of two stalwarts, Rishi Shukla sir and Sunil Jain sir. We've had the privilege of learning from you, and it makes me a little bit anxious and nervous to be talking right now. Thank you to our chairpersons, Dr. Vipul Chawda and Vaishnavi. Thank you for this opportunity. Every time, whenever we have a pediatric diabetes symposium, generally the topic is challenges and solutions in type 1 diabetes. So my first point today is that whenever we talk about pediatric diabetes, it's not just type 1. There are various other forms of endocrinopathies and diabetes that are detected. There is MODY, there's a Rogers syndrome, there is obesity-induced hyperglycemia, which we are seeing quite often now in pediatric population. And that is why it is my earnest request to all the listeners to be reading more often when we define pediatric diabetes. But the topic given to me today is managing type 1 diabetes in challenging situations. So first of all, we have to find challenging situations like the one right now today, that whenever we are given a platform to talk about challenges in type 1 diabetes, the audience or the targeted people are in a smaller room, whereas the targeted population should be something much more, because we have to educate the healthcare professionals onto what is type 1 diabetes and how can we better the lives of people living with type 1 diabetes, be it kids, be it adults. So I would like to extend my heartfelt thanks to all the organizers of RSSDI 2021, my mentor, Dr. Banshi Sabu sir, Vasant Kumar sir, and Sanjay Agrawal sir. So it's a very simple agenda that I have. We'll first talk about the challenges and then we'll come to the solutions. So the first challenge which I feel is information, type 1 information. There are so many myths and prejudices and notions that we are encountering, like the one we had in the pandemic. There was somebody claiming to cure type 1 diabetes. So a lack of information. I think just a day before, there is something trending on Twitter by the BMC talking about type 1 diabetes and reversal, and wherein we do not mention the type of diabetes. So yet again, a lot more information, a lot more correct information for that matters needs to be imparted, and that too in a well propagated manner when we talk about type 1 diabetes. Of course, we know that India has one of the largest population when we talk about prevalence of type 1 diabetes. This is the Southeast Asian data and the Indian data when we talk about incidence of type 1 diabetes. Now, a very old slide, but still one of my favorite slides when we talk about the challenges, that there are challenges at the community level, challenges when we talk about the school level, we talk about the family and even healthcare professional. And we are celebrating this November month as the Diabetes Awareness Month, and the theme is access to diabetes care. That is again one more challenge that the people with diabetes, be it any kind of diabetes, are facing. And it is similar when we talk about type 1 diabetes, that accessibility to insulin, affordability of insulin is still one of the major challenges, despite the government and associations like RSSDI still contributing a lot. So what I have done is I've divided the challenges into three major parts: challenges related to diabetes self-management, related to the healthcare system, and related to the psychosocial aspect. Some recent papers that came out talking about challenges in type 1 diabetes, challenges related to COVID-19, and one of our papers along with Pratap Jethwani sir, Banshi Sabu sir, Kalra sir, Jyoti sir, we came out with this paper at the end of 2020 talking about how in India there are various different challenges that we face during the pandemic for management of type 1. We had this session yesterday, and I hope everyone had the opportunity to listen to all these stalwarts. Some of the solutions, again, since I have to talk about management of type 1 during the challenges, so let's very, very empathetically and with emphasis talk about the solutions more. This is an international slide, and this was presented by Karen de Beaufort. She's the president of ISPAD right now. And very, very nice slide. It is talking about access to the insulin toolkit. It is talking about different countries' estimate of the price, also for the need of different kind of databases, and also for different kind of guidelines in relation to different types of insulin. So now all of these consensus guidelines are present. All of these solutions are also present. The only thing is, how do we teach the healthcare professionals? How do we bring the message to the healthcare professionals and also to the people living with type 1? Now, the first thing when we want to find out solutions is we have to understand what are the essential components. Medical nutrition therapy, physical activity, insulin therapy. Of course, all of us will agree right now that type 1 diabetes requires insulin, insulin, and insulin. That is the only first thing that we have to remember. Monitoring, of course. Diabetes self-management education. We've had the previous session on technology, and we all know that all of these technology has to be self-used by the person with type 1 diabetes. Let's not call them patients also, because that's what we are talking about, language matters. And that is why the person with type 1 diabetes has to be educated on how to take care of himself or herself. And of course, the psychosocial support. Even when we are going through something, we require peer support. We require support of our family. And that is the same case for people living with type 1 diabetes. So this is a very, very beautiful line from one of the papers by Jyoti sir. He talked about type 1 diabetes challenges in Southeast Asia, and he said that management of type 1 diabetes requires such a strong commitment on the part of a healthcare professional, of the family, of the patient also, and even of the government bodies. And it's not a small thing. What we are doing is we are dedicating our time, our life, and I am sure all of us sitting here, even if we are a handful, all of us have spent more than half an hour or more than 1 hour sometimes for a newly detected type 1 patient. And there is a need for infrastructure, there is improvement, there is a need for a holistic approach that we keep on repeatedly talking about, but I fear that it does not exist out of this room. All right, so I'll be talking about the solutions. One of the challenges, accessibility to insulin therapy. We are doing a lot of programs, projects relating to making insulin more accessible. RSSDI is doing so. There is a Changing Diabetes in Children program by the Novo. There is another Life for a Child program. All of these programs, and I think us as individual institutions are also doing a lot on our part for providing insulin at a very, very lower cost for our patients. Glucose monitoring, of course, even if we are debating DGM and CGM and any kind of monitoring is important. Let's counsel our patient first that monitoring needs to be done. There are places and there are people where we are still debating and we are still trying to counsel them कि भाई आप monitor तो करो, उसके बाद maybe we can talk about the modalities or the different kind of meters or different kind of technology that might be available. And medical nutrition therapy. We have so many nutritionists right now in the room, all of them dedicating their lives to management of type 1 diabetes. And I'm sure it is much difficult to make a mother understand or to make that child understand that beta aapko healthy diet follow karna hai jabki aapke aaju baaju everybody is going to have an unhealthy lifestyle. It's heartening to understand that on our part also sometimes. Physical activity and sick day management, there is again a separate module on understanding various different protocols and various different ways of how you can prescribe exercise to a person with type 1 diabetes of any age, depending on their glycemic levels, depending on their comorbidities. For a sick day management, increase in monitoring, changing in the insulin dosages, how much it is important. Now we come to this point, emergency preparedness. We saw the COVID pandemic, none of us was prepared for that. These were all unprecedented times where none of us knew what needs to be done. A lot of papers came out talking about how type 1 diabetes and COVID-19 together caused so much of mortality, so much of morbidity in people with uncontrolled type 1 diabetes, and they cause so much of diabetic ketoacidosis. So what the bodies came out with, the associations came out with, that there are specific problems when we talk about such emergencies. There is accessibility issue, increase in food insecurity issue, interrupted shipments and supplies issue, reduction in the diabetes center's income also. I'm so glad that associations are talking about the healthcare professionals' incomes as well. There is issues related to accurate information, be it for the patients or be it for the healthcare professionals, and they are also talking about impact on the health budget. So these are various solutions that they have come up with, and some very, very interesting solutions are volunteer-run social media groups that have been very, very helpful. There are a lot of healthcare professionals who have come out and done their part in adopting kids with type 1 diabetes and in adopting various different methodology to support pediatric diabetes, to support kids who have type 1 diabetes. And they have provided them with supplies, not just insulin, telemedicine, but also food supplies, supplies for strips, and supplies for insulin also. Now, this is a very pretty, passport that I found out from the internet, that emergency preparedness plan should include some of the documents, some of the medical supplies. The first, of course, comes insulin, along with some extra supplies of syringes and pen needles that have to be there. And if you're on a pump supplies, other medications for emergency conditions, like for fever, for pain, or for vomiting. People talk about glucagon kit, but you could just keep a hypo kit with you. And Sunil sir and Rishi sir, both of them have their own, small hypo kits, which I have, had the privilege to see. Glucometer, even the cells and the power cells for glucometer are something that you have to keep prepared for times of emergency. So there should be a small bag labeled for emergency uses only, like we keep our passports and everything somewhere. So for even the type 1 kids, there should be a small emergency bag which should have all the necessary supplies and medicines that could be, handy. There need to be some solutions relating to the healthcare system also. There are, of course, telemedicine guidelines. Virtual diabetic clinic also have been set up. But again, it is my personal opinion that there's nothing like a physical face-to-face or a physical, contact that can make a lot of difference. Emergency issues related to glucose control. Again, we have always emphasized on counseling of the patients for emergency situations like DKA, sick day management, as well as for hypoglycemic episodes. Emergency situations related to the COVID-19 and other infections also, which can precipitate DKA. There are various different healthcare authorities that have come out with their own guidelines, what to do during COVID-19. And of course, technical issues, just like Sunil sir has already presented. There are so many, with everything new, comes some of the cons that we have to face, and we have to understand and put a line that this is something that ye patient ko ye itna samjhana is necessary. This patient can do something which is as like an APS system. For others, it is a simple Medtronic pump. Now there are solutions which we need to talk about relating to the psychosocial aspects. Again, a community approach, a group approach. Education, when you keep all of these kids together, there are camps that I think all of us are doing, trekking programs that RSSDI is doing along with other associations. The information booklets, all of these are much, much helpful for people with type 1 diabetes. Economics, some of the very, very important aspects that we miss when we talk about. There are vulnerable families which need support, not just in terms of insulin support, but also scholarships, support in terms of supply for the basic essential care or essential amenities for their life. So in summary, I would like to show that these are some of the basic solutions for optimal glycemic levels and zero complications, be it for emergency situations or non-emergency situations. And they are, knowing exercise, knowing nutrition, knowing adjunctive therapy, the knowledge and the willingness to implement all of these along with the diabetes technology is a part of the solution. Medical home care, psychological support, family dynamics, resilience, and having a type 1 diabetic community, all of them in a holistic care support is better for all of us. Again, this is one of our papers talking about type 1 diabetes registry in developing countries with Sabu sir. And this is a very cute boy, Paul. Even if you give them everything, but if you don't give them education, there is no use for all of this. And if you just give them education and nothing from this, it makes no sense. So together, along with all of this, we can actually make a difference. All the various programs that we are talking about, LFAC, CDIC, the RSSDI Type 1 Insulin Project in India, And one more important thing that we don't talk about is data collection. Data collection and retrospectively analyzing what we are doing better. And I swear we all are actually doing much better than the developed countries when it comes to tackling type 1 diabetes in spite and despite of any contradictory situations. So I know my time is up, but education is something that we believe in. And these are all our education classes that Dr. Chawda and myself have been conducting. And I welcome you all. You are all in Ahmedabad. If you get the time, please spend 5 minutes at our institute. We have 2 hospitals, and we do run an education unit as well, along with a research unit. Thank you so much for a patient listening.